Hey, this is Dr. Kraft from Advanced Chiropractic Relief in Mooresville. I'm here with Nick today. Nick was referred in by his boss who came to see me yesterday, a longtime friend. So told him about the RingDinger. So Nick is a football player here in the past and had some injuries or had some stiffness as a result. So he's about 5 or 6 years developed this kind of upper back neck issue. Obviously it causes just basic stiffness. He does have acute exacerbations from time to time where it does cause more pain. He sees a therapist and has gotten some kind of soft tissue work and some cupping in the past and been seeing them I think twice a week since September.
Yep.
Is that right?
That's correct. Yep.
So we're going to bring him in. We talked about compresses and so forth. He does obviously in the gym, does some weight training and so forth. Does a lot of physical work. Lifting and so forth, and so I think all this stuff has just compacted his spine. He's got severe stiffness in his upper back and thoracic and overdeveloped musculature. I think it just adds to all that compaction. So we're going to break him apart today with the RingDinger and get aggressive with him. You ready to get started?
We're ready to go.
All right, let's have you go face down. We've already evaluated Nick and done some orthopedic, neurological, and a big family history, so he's clear for this type of adjustment. So we're going to get in and just get to work. Nick's got kind of a right short leg. When you bring it up, it goes normal, so positive deer feel, but you can see that wear on his shoe. So his gait has adapted to kind of his spine, and so getting some uneven wear. So hopefully we're going to get him straightened out here today. All right, here we go, Nick. It doesn't help with his heel, but it's definitely straightened his legs. Gone up, those look good. You can see Nick, big sway back down here, which just kind of caused all this to go the opposite way. So lots of pulling. We're gonna get in here and see if we can get this broken apart. All the way out, a lot of pressure, Good, good. Feel the headpiece pop up. A lot of pressure here. A lot of pressure. A lot of pressure. Good. Let's flip you all the way over. Just pressure. Shoulders. Shoulders. Ribs. Nice. Oh yeah, good. All right. Let's bring you up. Good. Good. So, you ready for the big one? All right, let's bring you all the way. Right about there, good. All right. So Dallas tell you about this a little bit?
Yeah.
Did you see the videos?
Yeah, he showed me the videos yesterday.
Okay. All right. Now, I'm going to get you skinny here.
Need it tighter?
This is the worst part of it. I tell you, I did 3 in a row and my ribs are killing me.
Oh, yeah.
Give me your hands, I'm going to pull you tight. Okay, now, we talked about how we're going to raise these legs, right?
Yep.
And this is going to take that lumbar curve, which you've got a big one.
Correct.
So I'm going to get these legs up real high. Try to level out this spine so we can get down this thing. Give me a second, I'm going to wrap this get this kind of snug. Okay, so again, we're going to keep that stomach relaxed. What I want you to do, teeth together, I want you to take a nice deep breath in through your nose and all the way out, and just let it all the way out. It's just going to be lots of pressure here. Good. All right. All right. Feel that a little bit?
Yeah, a lot of it. Yeah.
All right, just relax. Take a couple deep breaths there for a second. Now, I felt some good release in the neck. How far did you feel that go down?
About halfway.
About halfway. Yeah, me too.
Correct.
I definitely hit rock, but
Yes.
I definitely felt some great movement up through the neck.
I did, and upper back.
Yep.
Correct.
I want you to really relax that nice and loose. Let that nice and loose for me. I know you're grabbing that. Good. Good. Okay, gonna just stretch you here a little bit. All right, let's bring you up, Nick. Let's bring you up. Go ahead and have you stand for a second. All right. Feel yourself a little taller?
Yeah.
You look a little taller. Let's bring you around over here.
I get some boots without worn out on the heels. The right side.
Now, do you feel that flushing that we talked about, sort of?
I did over my face, my head, and down,
Yeah.
down through my body.
Yeah. All right. So you didn't really have any. You were already even here, and it looked pretty good here. What I'm looking at is from the side. Now you kind of, you're here. You're not quite as forward, so we definitely were able to pull you back a little bit.
Right.
Let's have you go forward. Through your muscles. Pull your shoulders back. Yep. Arms out like that. Yep. I'm gonna take your head and I'm gonna try to translate. Just let me push it back. Good. Just pressure here. Good. Okay. All right, now you didn't come in with major pain to begin with, but as far as stiffness, and I know it's tough to tell right now because I just moved joints.
Yep.
Now the next 72 hours, you're gonna get a reaction in the muscles.
Yep.
If you get sore, I always tell people 72 hours, you know, get ice in a Ziploc bag, crushed ice,
Yep.
so that it goes flat on the skin in 15, 20 minutes if it gives you a problem. Now you're in shape, you might not have issues, but if you do,
Okay.
kind of make sure you use that. But how does it feel stiffness wise, and how do you feel different after this right now?
Definitely neck and my upper back, which were the problem areas. I mean, I don't feel like everything's bobbled into the between my shoulder
Right.
blades like I did. I mean, I just.
Do you feel that decompression
I
feeling?
did, yes, especially.
Yeah.
You know,
Yeah.
and I mean, I felt the neck all the way down, halfway down my spine.
Yeah, yeah.
I did just kind of a release and.
Yeah.
You know,
Good.
you know.
Good, and like I said, we got a couple more to see how this works, but I appreciate you coming
Yeah,
in
man.
today, Nick. It was a pleasure.
Thank you. Yes, sir.
Dr. Kraft, your Mooresville RingDinger doc. Thanks for watching us today. Make sure you like and follow us. See you next one.